Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dengue fever. Introduction. Dengue is an infectious disease caused by a virus. You can get it if an infected mosquito bites you. It is common in warm, wet areas of the world. Outbreaks happen during the rainy season. Most people with dengue recover within 2 weeks. However, some dengue infections are severe and cause bleeding from your nose, gums, or under your skin. Severe dengue can also cause massive bleeding and shock, which is life-threatening. This program discusses the symptoms, causes, diagnosis, and treatment of dengue fever. Information about ways to prevent dengue fever is also included. Dengue fever. Dengue fever is an infectious disease carried by mosquitoes. It is caused by any of the 4 related dengue viruses. Dengue fever used to be called breakbone fever. This name refers to the severe joint and muscle pain that dengue fever can cause, which feels like bones are breaking. There are 3 main types of dengue fever. Classic dengue fever, which typically is not complicated by other illnesses. Dengue hemorrhagic fever, or DHF, which causes bleeding and internal damage to the body. Dengue shock syndrome, which is similar to DHF but also includes the risk of shock. Dengue hemorrhagic fever and dengue shock syndrome can result in damage to the blood vessels and liver. Health experts have known about dengue fever for more than 200 years. It is found mostly during and shortly after the rainy season in tropical and subtropical areas of Africa, Australia and the South and Central Pacific, the Caribbean and Central and South America, India, the Middle East, Southeast Asia and China. Although it is mostly found in tropical and subtropical areas of the world, dengue fever is not limited to a specific location. Any area infested with the types of mosquitoes that transmit dengue virus is at risk.
The illness causes 22,000 deaths per year, mostly in children. In addition to typical dengue, dengue hemorrhagic fever and dengue shock syndrome also have increased in many parts of the world.
Symptoms. Symptoms of classic dengue fever usually start within 4 to 7 days after you have been bitten by an infected mosquito. Fever is often the first symptom. The fever may cause a temperature of up to 105 degrees Fahrenheit. Other symptoms of dengue fever include nausea and vomiting, pain behind the eye, severe headache, severe joint and muscle pain. A rash may also appear over most of your body. This often happens 3 to 4 days after the fever begins. The rash usually goes away after 1 to 2 days. You may get a second rash a few days later. Most people completely recover from dengue fever within 2 weeks. Some people, especially adults, may be tired or depressed for several weeks to months after being infected with the virus. Symptoms of dengue hemorrhagic fever include all of the symptoms of classic dengue plus bleeding from the nose, gums, or under the skin, causing purplish bruises, damage to blood and lymph vessels. This type of dengue disease can cause death. Dengue shock syndrome is the most severe form of dengue disease. Symptoms include all of the symptoms of classic dengue and dengue hemorrhagic fever, plus fluids leaking outside of blood vessels, massive bleeding, shock, which is very low blood pressure. Dengue shock syndrome usually affects children and sometimes adults experiencing their second dengue infection. In some cases, it can cause death, especially in children and young adults.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Mosquitoes carry the virus that causes dengue fever. but mosquitoes first become infected when they bite an infected person. In this way, humans and mosquitoes are both responsible for the spread of dengue. The virus can enter a person's body when an infected mosquito feeds on his or her blood. Dengue fever can be caused by any one of 4 types of dengue virus: DEN1, DEN2, DEN3, DEN4. You can be infected by more than one type at different times during your life. You can only be infected once by the same type. This is known as immunity. People who have been infected with classic dengue fever have a higher risk of developing severe dengue fever, also known as dengue hemorrhagic fever. Their risk goes up each time they are reinfected with a dengue virus. Diagnosis. Your healthcare provider will begin diagnosis by discussing your medical history. He or she will ask you about any recent visits to areas where dengue fever is common. You will also receive a physical exam during your visit. This helps the healthcare provider decide whether your symptoms are caused by dengue or some other illness. Your healthcare provider can diagnose dengue fever by doing 2 blood tests 2 to 3 weeks apart. The tests can show whether a sample of your blood contains antibodies to the virus. Antibodies are proteins in the body that help fight viruses and other illnesses. During a dengue epidemic, a healthcare provider often can diagnose dengue by typical signs and symptoms. Treatment. There is no specific treatment for classic dengue fever. Most people recover within 2 weeks. To help with recovery, healthcare experts recommend drinking lots of fluids, getting plenty of bed rest, taking medicine to reduce fever.
People with dengue fever should not take aspirin or other non-steroidal anti-inflammatory drugs, NSAIDs. These medications may make it harder for blood to clot, increasing your risk of bleeding. Talk with your healthcare provider about what fever-reducing medicine is safe for you to take.
For severe dengue symptoms, including shock and coma, early and aggressive emergency treatment can be life-saving. Treatment often includes fluid and electrolyte replacement. Prevention.
The best way to prevent dengue fever is to take special precautions to avoid being bitten by mosquitoes. When outdoors in an area where dengue fever has been found, use a mosquito repellent containing DEET, picaridin, KRB 3023 or icaridin, oil of lemon eucalyptus, paramethane diol, PMD, or 2-undecanone. Dress in protective clothing, including long-sleeved shirts, long pants, socks, and shoes. Treating clothing, bed nets, and gear with permethrin can also help.
The type of mosquitoes that cause dengue usually feed during the day. This means it is especially important to take precautions against mosquito bites during early morning hours after sunrise and in the late afternoon before dark.
Other precautions include keeping unscreened windows and doors closed or sleeping under a bed net, keeping window and door screens repaired, using air conditioning, getting rid of areas where mosquitoes breed, such as standing water in flower pots, containers, bird baths, and other areas where water collects. There is a vaccine that lowers but does not eliminate the risk of getting dengue fever. In some cases, patients who get dengue fever after vaccination may have a more severe illness. This is why it is important to talk with your healthcare provider about the vaccine and whether you are a candidate for it. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Dengue is an infectious disease caused by a virus. You can get it if an infected mosquito bites you. It is common in warm, wet areas of the world. Outbreaks happen in the rainy season. Most people with dengue recover within 2 weeks. However, some dengue infections are severe and cause bleeding from your nose, gums, or under your skin. Severe dengue can also cause massive bleeding and shock, which is life-threatening.
Early diagnosis and treatment of dengue is critical as epidemics of the disease become larger and more frequent. In severe cases, people infected with dengue may experience severe bleeding, shock, and death.
Severe dengue is often treated with aggressive emergency treatment, which includes fluid and electrolyte replacement. Prompt treatment can be life-saving. Dengue can be prevented by limiting exposure to the mosquitoes that carry the virus.
When outdoors in an area where dengue fever has been found, use a mosquito repellent containing DEET, picaridin, KRB 3023 or icaridin, oil of lemon eucalyptus, paramethane diol, PMD, or 2-undecanone. Dress in protective clothing, including long-sleeved shirts, long pants, socks, and shoes. Treating clothing, bed nets, and gear with permethrin can also help. Thank you for using Explain.